Hi, everybody. Welcome back to another episode of the ASAP Pathway podcast. I am beyond thrilled today because I've got the other founders of ASAP Pathway with me, Doctors Tracey Nguyen and Michelle Weddle. And this is just something I really wanted to do for a while, is help everybody understand, how ASAP formed, who we are, what our mission is. What's our goal for 2024? And I just really wanted to bring in my partners and have some conversations, much needed conversations, so people can really understand what this all is. So please introduce yourselves, Dr. Tracey Nguyen and Dr. Michelle Weddle.
Hi, I'm Tracey Nguyen. This is where we have the bloopers. Like, am I supposed
You
to
know
talk
what? This
about
is like,
myself?
this is funny. This is my first podcast with 3 people. So this is interesting.
They're like, when you say please introduce yourself, I'm like, what do I do? Do I do my
Yeah.
biography? Which is like, I'm like,
say where you're from.
I mean, this is where we're like, and take 2, but we're not going to do that. I don't want to make editing any harder for my brother. But yeah.
So we get to say that you're the queen of the first take. You're a one-take wonder.
Oh my gosh. It's the only thing in life I can do is I'm good under pressure. Usually.
I remember when we recorded, we blanked out like that too. We recorded
We sure
our
did.
modules.
And I just was like, what are you guys doing? Stage fright. We got stage fright.
I always mess it up. Let me start it over. But hi, I'm Tracey Nguyen. I'm a restorative dentist outside of DC in Northern Virginia. And I am a scientific advisor for the Coy Center, accredited with the American Academy of Cosmetic Dentistry. My journey really started in cosmetic and restorative dentistry, but then probably in the last, 8 to 10 years, my passion has been airway management for all ages.
That's a really good description. And you really went, it's funny because some people assume, because I came at it from the airway perspective, adult airway, and came in that way into pediatric airway. And you didn't come in from the airway perspective at all. It was the restorative cosmetics, and then you got into airway.
Yeah, the interesting thing is because I'm a restorative, and I mean, so everything for me was dialing that bite, making down to the millimeter. Everything had to be perfect. And when I started getting into interesting sleep dentistry, and I started seeing patients in oral appliances and changes in the bites, I started to ask myself, it was interesting. I was like, okay, when is this bite acceptable and when is it not, and why? And that's where I actually really didn't enjoy the sleep dentistry side of it. And I was like, well, why are we only managing them at night?
Yeah.
Why, what we do impacts how they are during the day, because how we sleep affects how we are during the day, and how we are during the day affects how we sleep. So they're not, independent of each other. So my journey actually started, I guess, with Jeff Rouse. He was one of my mentors in the airway movement. And he really took it a step back from me. I'm like, okay, let's just look at restorative dentistry. Let's just look at what we do every day. And is there a potential in what we do every day to make the airway better? Or vice versa?
Yes.
Is there a potential to make it worse? And so it's funny, I thought of a catchphrase today for myself. I was like, making a beautiful smile is not enough for me anymore. I want you to feel and look well.
That's a
really beyond that.
Is that like a perfect segue to my
It is wellness in general.
ties it together. So my practice. So hi, I'm Michelle Weddle. I'm a general dentist from New Jersey, and my practice is great smiles, but my tagline is better health. Right. So basically, what Tracey was saying, how a beautiful smile is kind of just the beginning. right? What we want to do really is to help improve everything. So my practice is an integrative practice, but my roots is actually in TMD because I am a TMD patient, as was discovered very, very interestingly when my CVCT was evaluated in our ASAP module. So it's there for everybody's enjoyment. But I started as a CE junkie because I was trying to figure out TMD, and also I was doing orthodontics for kids. I was managing TMD in adults. And then I was traveling to all of these Panky. Actually, I had exposure to Panky as a dental student because my occlusion professor was a Panky dentist. So as soon as I was out of dentistry, out of dental school, I was in Dawson and Panky. And with the reconstructive dentistry, restorative dentistry that we're doing with worn dentition, it gave me such agitation and such like anxiety almost, because I would follow the protocols and restore somebody's dentition and it would work, and then I'd follow the same exact thing on another person and things would be breaking. It just wouldn't work, and I couldn't figure out why, and so I didn't want to do it anymore. It kind of sucked.
Yeah.
So, right,
You're like, what's happening?
you don't want your work to break. And then, it's disappointing for the dentist, it's disappointing for the patient. So we, in search of all of these things, Panky, Dawson, Coy, Spear, really, but what we were circling was airway. So I came into the airway field not from a restorative standpoint, really, but I kind of was able to tie it together so that the patients that we were restoring they're not breaking down anymore. So TMD and airway really is where I'm coming from. So all three of them really, but my initial gut instinct that got me into this rabbit hole was because of my experience with TMD. So,
well, then the three of us started going down the rabbit hole together, and we all met. Gosh, was it 2019, early 2019 or 2018?
2018. I think 2018.
It was earlier.
No. I met Michelle probably. So I was asked to mentor the first Airway Pros workshop with Jeff Rouse. And I met Michelle that year because I hosted a course locally, and then we just happened to be attending all these courses together.
I think it was a year before that, Tracy.
Yeah, I think it was like 2016.
Yeah.
Maybe 2016.
Somewhere around there, 15, 16, somewhere around there was when we and I met you at your course. You hosted a myofunctional therapy course right in your neighborhood. And then I remember the next 2 or 3 courses or 4 courses, even like every other month I was seeing you. And I'm like, we're on the same track here. We're following the same rabbit hole.
We're both confused.
Exactly. We all had the analysis paralysis.
Well, yeah, and that was the problem because like we, like every course left you hungry.
Yeah.
And it was just like
questions.
Yeah.
And you would apply it in practice and you're like, well, this isn't what I was expecting.
And I think it was very humbling to speak to somebody with the same struggles. Because I think, everybody's trying to be somebody, and we were just being really honest with each other about the cases that we're seeing. And, and not to say, but some of these courses and a lot of the over promises, and we were very honest with each other. We're like, we're not seeing that.
Yes. And it's very humbling to say, because we started doing these things called Sunday chats. And it was funny because I'd be sitting at the kitchen table and my husband would be walking by in the background in the kitchen. And there we are, he'd see your faces every Sunday and we'd throw up cases. And the vulnerable, just being vulnerable, saying, you know what, I tried that device. I'm not seeing a point move. And is anybody else seeing this? And it didn't work. And why is this kid breaking every device that I'm putting in their mouth? And then, because here's what happens, guys. You call the company and they say, oh, well, we've never heard of that before. Like, am I the only one going through this? And we weren't. We weren't the only
No.
one going through. So
No.
I think that's when, and to throw out some props to Jameson Spencer. He heard about us, and what we were doing and said, you guys need to do something because nobody's doing
My
this.
mentor,
Yeah.
right?
I mean,
So,
Jameson
so
got
Jeff
me in.
House was Tracy's is Tracy's mentor. I mean, I think Jameson is a mentor to a lot of people.
Yeah.
So
Yeah.
I mean,
kinda,
Jameson got me and Michelle to lecture together,
that's
Yes,
right.
that's right.
and
We did a myofunctional therapy lecture together, and it was his pairing.
I
don't
tell
think we
myself,
thought to do that.
yeah, I tell myself every time I'll never lecture with Michelle, but I keep on lecturing with her. I love her to death, but she
We're
gives
in
me
different time
anxiety.
zones, and you give me anxiety. So yeah, we are such opposites that it's like sometimes it's anxiety driving, but it's like good too. It's like, I don't know, I feel a rush when I'm lecturing with you, just because I think the end result is really good because of the collaboration, because we approach things so differently.
Yeah.
So
Yeah.
let's tell people that may not understand, like, if what is ASAP pathway? This reminds me of us recording. What is ASAP pathway?
Love that blooper.
That was
I
a
think it's
blooper.
on YouTube. Yeah, yeah.
Well, it's airway, sleep, and pediatric pathway.
I'll let you take that, Michelle.
Really? Me? Okay. So airway, sleep, and pediatrics, but it's also a play on ASAP, right? Because these kids can't wait. When we see it, we need to address it as soon as possible. Just because we know these kids are not growing in the trajectory, they're not growing to be their best selves. If there's an airway issue, if they're not breathing well, if they're not sleeping well, their bodies, they're being put together at that time. They're growing, their brains are forming, their organs are forming. So, it's not something that we can kind of turn a blind eye on. And a lot of our members say the same thing. It's like, once you see it, you can't unsee it.
And we know so much. We know too much now. There's too much literature saying with the neurocognitive deficits, and this goes beyond sleep apnea. This is about mouth breathing. It's about nasal obstruction. It's about poor function, issues with myofunctional, aspects, improper swallows, improper breathing, improper growth and development. And now that we're seeing all these neurocognitive deficits, I mean, it's just, they don't grow out of it. They do not grow out of those neurocognitive deficits. They grow into those neurocognitive deficits. And so that's the urgency behind us.
Right. It's happening right then and there before your eyes. And, I see a lot of kids, in addition to the neurocognitive, right? Or maybe because of, there's a lot of behavioral
Yes.
comorbidities also. There's just anxiety, depression, just a lot of that. I have a few patients, unfortunately, where in the middle of diagnosis we had to stop because they ended up having to go into the hospital and are being seen as inpatient, for inpatient care. So the reality of what our children are going through, not because of this, but related to this.
Right.
It could be a contributor. It could be, not sleeping. Gosh, right?
So it's
That's
interesting. Yeah. So I had a consult the other day, and you guys will, so I usually get I get patients and children of all different ages and different parts, so I get a lot of where the neurocognitive is already set in, and the parents they're looking for answers. And there's a lot of parental guilt. Like, you saw the signs, but you didn't do it. And there's so a lot of that consult, it's like, we just didn't know. And so I had a consult, I was talking to this lady, and she brought in her 3-year-old, and obviously I'm treating her 7-year-old, not her 3-year-old. And she's like, what do you think? Do you think we need to do it? I was like, well, right now, we don't have any neurocognitive consequences. Right now, your child doesn't have any issues. So I can't ethically tell you that I'm going to prevent neurocognitive consequences. But you've seen the signs already. You know what to do. It's a judgment call. It's a tough call, I think, for parents to make, because I typically get them too late where they have the mommy guilt. And then they're like, I wish I would have treated him younger. But unfortunately, with this profession, the way it is, we can't say we're preventing something, because the neurocognitive, you can't, there's no
How
study
do you prove that? Exactly. How do you prove?
there's
I
no
intervened
study.
at 3 and they don't have it. Well, what if they would have never had it? So it's hard to-
So it's such a tough
Can't go back
call.
in
And
time,
I
right?
tell my parents, it's like, look, I mean, all I can tell you is, and it's interesting because with this 3-year-old, I mean, the crowded are, I mean, it was so near. I was like, all I can tell you right now, I can say with 100% confidence, your child's going to need braces because
Yes.
because
Yes.
there's no space here. I cannot tell you with 100% confidence that your child is going to have neurocognitive consequences. I can just tell you that, like, this is what I see moving forward, and you make that call. And I think that's a very tough call for parents to make. And it was a struggle for me to have that conversation because I didn't know what the right answer was, but
And
we get
sometimes when
them
you don't know,
afterwards.
sometimes when you
Yeah.
don't know the right answer, it's not your question to answer.
Yeah. That's really important to say. Yeah.
Yeah.
So it's based on the parents' philosophies, it's based on their belief, how they want to lead their life, what kind
Yeah.
of care they want to provide for their children. It's not something that we would dictate. It's not something that's up to us. But I feel sometimes what we as providers are obligated to do is just say, like, for example, if I go to a physician and I have the risk factors for diabetes, I have a genetic tendency for diabetes, that physician is going to counsel me on, okay, there are risk factors that I see. We can mitigate the risk factors and that'll decrease your likelihood of developing diabetes. So
Yeah.
the same thing, right? We see risk factors. We
But
don't know.
they can't look at you and say, I promise you won't have
promise.
diabetes if you do all
Yes.
these things. They
Yeah.
can't.
Well,
So, yeah.
a study
Despite,
that go ahead.
no, go ahead.
A study that I quote a lot, and I have it on my literature review. David Goodsall does an amazing job in 2022 on the neurocognitive consequences of sleep disorder breathing. And basically, he said, even after treatment, so this is after treatment, after you've found what are the possible outcomes? The biggest one is 100%, 100%, all the neurocognitive consequences come back. You're fine. So a small percentage of people is going to come back. Yeah, full recovery. Then the next trajectory is a delayed recovery, meaning that even after treatment, they slowly recover. The third trajectory is no resolution.
Yeah.
And I tell them, it's like, the problem is we don't know which one you're going to have.
Right.
And
It's that
that's the
phenotype.
scary-
We
yeah.
don't know who's going to fall into
We
what
don't know that
bucket.
even after treatment, we're going to have recovery. So I think, Michelle, I think that's great that we said that we can just tell you the risk factors now. But I mean, I have so many kids that I treat that are ADHD, and I'll be very honest, like, not all of my kids are off meds. It's almost too late at that point.
Well, that's what Stephen Sheldon says.
Yeah.
Yes. He says, after 6, that's when most of those things are, he would say they're broken. And it's kind of, they just never quite connect the way they were intended to. If you don't get to these kiddos with these desaturations and sleep fragmentation, you got to get to them 3, 4, 5, 6. And that's what all the studies, a lot of times. And if you look at when most people see, a healthcare provider for any craniofacial or orthopedics or orthodontics, it's 7, 8.
Yeah.
So they've already, but I think too, it's interesting. I was talking to an orthodontist the other day. I've got a podcast that's being launched, our podcast coming out this Thursday with Mike DeLuke, but he brought up a paper. It was from the 1940s. It's the 75th year anniversary of this paper being released. and it was called Prophylactic Orthodontics. And this paper was part of an orthodontist being boarded within the American Academy of Orthodontists. So it's interesting because it was part of, getting that, being boarded as an ortho. And it was all about, when you see the malocclusion, address it right away. Do not wait. I mean, these were primary dentition cases too. And it was called prophylactic orthodontics. And I'm like, I really like that, because when we're seeing these 3, 4, 5, they're in a demographic that they're not on the radar of the typical orthodontist. And it's not, right now, it's not, I guess it's not being done on a regular basis, where a 3, 4, 5-year-old would be an Invisalign. So, but it's more of a prophylactic aspect. And we're not saying you'll never need braces, but if you see the malocclusion, like I was saying it recently when I was speaking at Winds of Change, I showed a picture of a kid, a little 3 or 4-year-old with glasses, a little 3 or 4-year-old with hearing aids. You're not going to wait when you see a deficit. You're going to act. You're not going to say, I'm going to make you go, longer until you're not growing as much, so you don't need as many expanders. I mean, that's not how healthcare works. We don't wait for children to stop growing until they need less glasses and they don't have to keep being measured for the hearing aids. So, we need to really look at ourselves comprehensively, and we're looking at this child who already has a deficit. They're already behind. So our goal is to get them back on track for what a 3, 4, 5-year-old should look like for that age.
Yeah.
That's the point of early interception. And I mean, and definitely, like you said, Tracey, you never want to overpromise and underdeliver. And I think that's the beauty of ASAP. What we've learned is we know how, we have a seat at the table with our medical colleagues, but it's staying in our lane. It's doing comprehensive dentistry that also has whole wellness ramifications with it as well.
The other thing that Tracey said is that she's seeing patients that have mommy guilt, right? And, a lot of, part of the reason why I'm so passionate about kids and Stacy and Tracey is we see a lot of kids, but we've lived it, right? I was that mommy who didn't sleep.
Yeah. Same.
Yeah.
I remember crying because I wasn't sure what the right thing to do. Do I get the tonsils and adenoids out? Do I expand? I mean, you have all those dilemmas, and what's the right thing to do first? You want to do the right thing for your child. It's all you want to do as a mom, is the right thing for your kid. And I mean, that's a very real thing. I mean, there's things I know now, like when we talk about stuff in our member meetings and stuff, I'm like, oh, I wish I would have done that on Ben when he was young.
I wish we had known this information.
Yeah, I wish I would have known this back then. He's 20 now.
Like a lot of the beauty now is that there's a lot of resources.
Yeah.
Like, I think our website, asappathway.com. I mean, for our parent listeners, there's a test that you can take. Like if you think that you have the signs, there's a test that you can take, and then it will connect you with one of our ASAP providers. One thing I think I'm really proud about, or we were proud about, is like, we really do understand how to work with our medical colleagues, understand the interdisciplinary approach. I always say, like, we know how to call audibles when things don't work out the way it's supposed to, because that's going to happen a lot. No child is the same. Every treatment is different. I mean, for the most part, I start off with the standard treatment, but I call a lot of audibles during the treatment. Like, I was like, this didn't work for you. It's funny because I had one parent that goes, what expander should he wear? I was like, whichever one he wears.
Yeah, whichever one he'll wear.
You've got patient preference. You've got behavior for the kids.
Yes.
You've got schedules that are different activities, sports, things like that they all factor in, habits.
And I think that's what's good about like our Sunday chats, and what ASAP turned into is our group is you know what? This is what collaboration is. I think dentistry is so different from medicine is, we get out of dental school, you go set up shop in your practice, and it's like, we all want this recipe that we can just chug every day. And that's not how humans are. And so you have to be able to go to a safe place and collaborate with other people and say, hey, has anybody had this type of situation? I mean, that's what our medical colleagues do. That's the difference is, we got to get off of our islands and get out of our silos.
Yeah.
And we have to start being in a community, because that's how this is going to grow and how we're going to grow as practitioners and help our patients. I learned so much. I mean, we talk literally every day. And even when you guys say something in a member meeting or whatever, I'm like, oh, I didn't even think to do that, and I talk to you guys every single day, it's.
There's a lot out there, but one of the things I'm proud of is the ASAP community that really has been built. And, you say that we're all in our own individual silos. And when it comes to pediatric airway, it's even more isolating sometimes, right? And then we're all spread across. I mean, you're in St. Louis, Tracey is in Virginia, I'm in New Jersey, and they're in all our towns. There's really not a lot of people addressing pediatrics and airway. So the community that is ASAP, where we can talk every day, it's a safe space. We can talk about all the good things, but also all those things that didn't work out, and we can troubleshoot together. That is, for me, like, it's like a relief. It's a relief valve. It's somebody's got my back, because if this doesn't work out, I know who to ask, and I know what kind of conversations I can have, frank, honest, safe conversations.
Yeah, because knowing what not to do is just as important as knowing what to do, which is something we all provide for each other too. Hey, I've done this. Trust me. Don't even bother.
You don't want to go down that road.
Don't even bother. I've done that.
I think we really try to there's so many treatment options out there today. And so we really try to hone it in and go back to like I always say, what's your diagnosis? What's your why? Because if you understand your diagnosis, it really doesn't matter how you do it at that point.
Yeah. What's your why? What are you trying to accomplish? What's the end goal?
What do you think is the problem? Yeah. Once you know what the problem is, then you talk about the solutions. I think today there's too much talk about solutions, not enough about what the problem is.
And how to identify, to be the detective that looks at the child and says, this is where we start.
But also, exactly, is where you start. You don't have to solve everything all at once. What do we solve first? What's next?
And we had Courtney Levine on. We just released her podcast, and I love what she said too. Now she's a general dentist. She's one of our ASAP members, and she's our faculty. So she teaches the interceptive ortho, and I love her perspective because she was a general dentist. I mean, high-end aesthetic restorative dentist for a decade, and then got the bug for comprehensive airway dentistry and said, that's it. I'm selling my practice and I'm going back to orthodontic residency. And what she said is, also it's knowing what you're not going to help. And I think that's where some of us got disillusioned that we are fixing everything with these kids and you put the whole onus on you. And that's not fair. That's not fair, but we definitely have a place and we can help that child. But what can you help? And what do we need to punt to our medical colleagues and get some help with maybe first? And you don't know what you don't know. So you really need to understand. I think the beauty of ASAP too is we teach sleep medicine.
Yes.
And we teach pediatric sleep medicine.
Right. Pediatric.
So that is its own, it is not adult sleep. It is not.
No. I mean, we know.
I have to say that's what I learned most from both of you. Like because I'm a big, anatomical person, dentistry, like all that. Oh, great. My dog's going off. But anytime I have a kid that's still bruxing, restless leg, I always talk about like vitamin D's, other things. Let's look at all these other things. And it's, I mean, I think that's what's the beauty of ASAP is um, we're not an appliance driven, orthodontic driven, solution driven. It's hone in, go back to your diagnosis. What else could it be? Who do you need on your team? And that's the key here. Like, and to really understand, I think and not to brag about our program, but I think what we do really well is understand everybody's role and to ask the question. Like we know what the ENT's role is, so we know the right questions to ask. We know what the pulmonologist role is. We know what questions to ask. The myofunctional therapist, the lactation consultants. We know who to grab into our team. Like we don't do it all ourselves.
And on that note, not just, I mean, I love this because Ilya, Dr. Ilya Lipkin, he's another one of our ASAP faculty, does amazing skeletal expansion coursework. One of his podcasts, if you haven't caught it, go back and listen. But he's like, I don't like the word airway orthodontics. I don't like it. It's comprehensive. And when you look at a child, you should be looking at the airway above the arches, the airway behind the arches, the TMJ joints, and I like what Kevin Boyd says. It's that,
I like that,
craniofacial respiratory complex. He calls it that. So I think the fact that we have all these amazing, brilliant minds that we all learn from each other, and the fact that it's comprehensive. And Michelle, in 2024, you have coursework that you're going to be teaching us on, which I cannot wait to take. The elusive TMJ. I mean, it's like, it's a mystery. People are afraid of it. So I'm excited that you're incorporating that next year.
We actually started that this year. Go ahead.
I'm going to create a new hashtag.
What is it?
Social media.
Total health dentistry.
Total health
dentistry. Total health
I'm
dentistry.
I'm going to hashtag that ASAP. Total health dentistry.
I'll put it in this podcast. Total health dentistry.
I'm going to tell everyone to do that. But I'm sorry, Michelle.
No. We have some modules on TMD, and we started that in 2019. Right? So we started incorporating TMJ, growth and development, because really you can't talk about how the jaws grow and guiding growth without talking about the joint. But we started a live course on TMJ this year because we wanted to, we wanted to make sure that we are taking, just like what Ilya said, taking the joints into consideration when we're doing our growth and development management. So Ilya put together a course for us. And God bless Ilya, because he is so full of knowledge that, what was it, a 2-day course? A 2-day course, and I feel like it should have been a whole week course. So one of the biggest requests was that, can we break it apart? Can we get it so that we can digest the material, we can go home and apply it. So all of our courses actually this year, TMD, early ortho intervention, and the skeletal expander, the MARPE and the MSE, we revamped it so that it would have the number one intention of allowing everybody to go home and really practicing this, incorporating it into practice, putting it into work so that they can help kids pretty much right away. So I'm excited about
that's awesome.
Our courses, right? So we have this, AGD has a protocol course where you take a course, you go home, you have the ASAP support, all of the whole ASAP community behind you, helping you implement, helping you diagnose a case, treatment plan the case. If you need, hold your hand, walk you through everything. I know Tracey was on the phone with a few members the first time they're placing the MARPE or the MSC. I'm going to be one of those people. I'm going to have you on I'm going to have you on Zoom while I'm
Everybody
doing
has me on speed dial.
Because we want to be able to implement this. That's why we're taking the courses. It's not
Yes.
recreation, right? So to implement it, and then to take the second part, because now that you've got your hands on it, you have more informed questions, and you can learn more because now you understand, not just philosophically, not just intellectually, but you've done it. You have working knowledge. So now you have questions, and everybody's questions really contributes to everybody's learning. And that's the other great part
Yes.
about it, right? Because everybody's on the same page. Everybody's learning together. The questions that are asked in the courses just fuel everybody else's learning.
Well,
And then
that's the thing is I think I keep hearing this. It's the wild, wild west right now of pediatric airway, and it is growing as it should be. Thankful that it is, because it needs to be. But I'm so proud. I know we are so proud of what our members are doing in their communities. I mean, what our members are doing in their communities, they are flipping rock stars. I mean, they're just going, they're just doing amazing things. I'm so proud of them. Trace, you've got, I know you can't say a lot, but there's some exciting things coming out with Invisalign, with the palatal expander, hopefully getting really, really, really soon FDA clearance. Are you excited about that, or?
So I am excited about everything that Invisalign does. Obviously Invisalign is not designed to for health and airway. I mean, not for health, but Invisalign is not designed to improve airway and breathing. But what Invisalign does do is it's just a different tool to do orthodontics. So the new expander is, there's a lot of great promise. I mean, there's many things that Invisalign does that advances orthodontics in general.
Mm-hmm. Agreed.
So the first thing is Invisalign First. What I love about Invisalign First is you can actually, children with already crowded arches where there's no, where actually even worse, where there's crowding in baby teeth.
Mm.
So we already know you need at least like a penny between each tooth to have enough space for adult teeth. So if you have crowding in baby teeth, forget about it. You're I would confidently say you're probably leaning more towards extraction if left untreated. So the beauty of Invisalign First now is we can actually intervene at a really young age. My youngest age right now in Invisalign First is probably 4. And we can really round out those arches,
Yeah.
correct these deep bites that help advance the lower jaw a little bit more. So it really does untrap that lower jaw, retrognathic jaw that we can do at a really young age. So Invisalign First for me is like a huge advantage. Again, Invisalign is not designed for airway, but it is another tool for orthodontics and alignment of teeth. And in
Yes.
that, you get airway as a side benefit, but obviously that's not what it's there for. The second advance that Invisalign has done is their mandibular advancement. That is Invisalign MA. And so a retrognathic jaw, which is a lower jaw that's receded, is a high risk factor for sleep disordered breathing. And so what that advancement does is it brings we kind of unravel the arches a little bit in hopes that we can auto rotate that lower jaw and bring that lower jaw forward. So there's a lot of appliances now, like twin blocks and mandibular advancement devices, that have been proven to improve airway and health and development. So Invisalign MA you can throw that in there, even though it's not technically approved for that particular reason. So that's number 2. And number 3 is the Invisalign Expander. That an expander alone improves nasal, reduces nasal resistance, expands the palate. If you expand the palate, the tongue will naturally self-correct, go a little bit more forward, open up the nose. So there's hundreds of years of research on expansion alone and the improvement in respiratory function. So I think Invisalign, to have an expander, is very next level. So right now, Invisalign First, Invisalign MA, and Invisalign Expander, it's definitely great, and I'm excited to get my hands on it.
I know our whole group is. It's like the buzz right now, and I think it's pretty much going to be any day. Like we're all
Yeah.
waiting.
Yeah.
We're all waiting to give it a try. And that's what's exciting about right now. A lot of us want answers right now that we're in the trenches. We're the ones developing, all of this general or primary care dentists, orthodontists that are in the trenches willing to start helping these kids. We're figuring this all out as we go. And I'm just so grateful I have the three of us together. I think we must text each other once a week. Thank God there's us.
More than once a week.
Thank God there's three of us to do this. And you know what, now with ASAP, thank God there's so many of us, because sometimes I pinch myself. I'm like, this went from Sunday chats to this amazing community. I just feel so blessed and humbled. I know you guys are busy, and I appreciate you meet with me tonight. I just wanted everybody to know that there's two other amazing partners in ASAP other than me on this podcast all the time. So sometimes they might host a podcast too. So I just wanted to get my team on here, and I'm so happy that I get to share this journey with you guys, and looking forward to years together, many more years together. I was going to end on, I do this with my guests, but technically you're not guests. You're also hosts, hostesses, whatever we want to call ourselves, and take you back to your childhood. I'm going to do a lightning round. I'm going to ask each of you. All right, Tracey, what was your favorite cereal growing up?
Kellogg's Frosted Flakes.
Ooh, yummy. All right, Michelle, what was yours?
Honey Bunches of Oats.
Seriously, it seems kind of healthy.
Hey, I named my brother Tony from Tony the
Tiger. That's so funny. Tony, that is right. I asked you, where did you get Tony? You're like, I named him Tony. Tony the Tiger from your favorite cereal.
All have a Tony.
That's funny. My husband's Tony. You've got a brother, Tony. Okay.
We both have a brother, Tony.
It's so funny. Mine was, I loved soggy Golden Grams. Like, let them just kind of sit in the milk. Oh, you didn't like that? Oh, it was my favorite, soggy Golden Grams.
I had Frosted Flakes the other day. It's so sweet. I'm like, oh my God, this is nasty.
I know. How did we? I mean, but we turned out okay. I mean, I guess. Okay, another one. Ice cream or sherbet? Which is your favorite, Trace?
Ice cream.
Michelle?
Ice cream queen.
Oh, you are an ice cream. Once a week, she's like, I'm going to go get a banana, or what do you call it? A boat float?
Banana barge from Carvel.
A banana barge.
Banana barge. Yes.
I'm an ice cream person too. And
every day in dental school, I had ice cream.
Really? Every day?
Did you?
Almost every day. I turned right, it was Carvel. I turned left, it was Baskin Robbins. Out of dental school. Right?
They knew where to set those up well.
And you all have this stress, and oh my gosh, what are you going to do? You go right, you're hungry, Carvel. You go left, Baskin Robbins.
All right, last one. Tracey, what was your favorite toy that you remember having? One of your favorite toys that you remember having as a little girl?
God, I don't know if I had a favorite toy. I mean, maybe Barbie. But like, I didn't have Barbie. I had like the knockoff Barbie.
So did I.
Like, I was very poor. We had knockoff.
So we were, yeah. So the knockoff Barbie doll.
Yeah.
Just, you like to play with the dolls. And
I loved Cabbage Patch Kids.
Oh, okay. Do you know my mom? We couldn't afford Cabbage Patch. So my mom had the neighbor down the street make one. It was the ugliest thing I've ever seen, but I loved her and I named her Melissa.
Oh my God, I want to go buy a Cabbage Patch Kid. I love Cabbage Patch
That
Kid.
was my fan. And I loved her. And she was ugly as all get out. What was yours,
I was
Michelle?
Scared of Cabbage Patch Kids.
Well, you would have been scared of mine because it was a knockoff that Marge down the street made for me. It
So
didn't
I
have
have
a.
two. I have two memories of my favorite childhood toy. One was a Hawaiian doll, long, beautiful hair, silky, right? Apparently, it was a collector's item, but I got it into my head that she needed a haircut.
Well, you chopped her hair off just like my brother did all my dolls.
And my mom had a fit. I was like, what is going on? I'm like, her hair was too long and she looked like, should I speak Tagalog? And she looked like a witch, right? Because my mom always said my hair looks like a witch because I don't like to comb it. So I'm like, oh, she looked like a witch. She looked like a bruja. So I cut her hair.
Oh, your poor dolls.
My poor doll. Yeah.
Well, we all turned out okay. I guess that's to be
Still to be determined.
Still to be determined. All right, guys. Well, I appreciate you and
Love you
so very much. Love you guys. And thanks everybody for joining us, and see you next time. And we'll have links to our courses, and parents, we have ways for you to get help. And I'll have links in our podcast. See you guys later.
Bye.